Hi everyone, and welcome back to Baton Medical. Today we're focusing on three key men's health topics: hypertension, cholesterol, and prostate cancer. These are common health issues, but the good news is that there are effective ways to manage and even prevent them. I'll break down what each condition is, how it affects your health, and what you can do to keep things in check. Let's dive in. First up is hypertension, or high blood pressure. Hypertension is when the force of blood against the walls of your arteries is consistently too high. Based on the most current guidelines, target blood pressure is less than 130/80 for most patients. If your pressures are higher than they should be, this extra pressure can damage your arteries and lead to some serious health complications, including coronary artery disease, stroke, kidney failure, and even vision loss. One of the big reasons hypertension is so dangerous is that it's often symptomless. You might feel totally fine, but as I mentioned, the pressure can be putting serious stress on your heart and arteries, causing damage to these sensitive organs. This is why regular blood pressure checks are so important, especially as you age. So, what causes high blood pressure? There's no single cause, but your lifestyle can play a big role. Diet is one of the main factors, especially sodium intake. Sodium is most often consumed in the form of salt and causes your body to hold on to water, which increases the volume of blood in your body and in turn raises your pressure. Most adults should aim to keep sodium intake below 2,500 milligrams daily. But if you have already been diagnosed with hypertension, that threshold drops to about 1,500 milligrams. This can be challenging for patients because of the sheer volume of sodium in many of the foods that we commonly eat. Just to give you an idea, a fast food restaurant fried chicken sandwich can have around 1,400 milligrams of sodium in one serving. That's nearly your entire daily limit for just one food item. In order to be safe, we should be very aware of our dietary intake of salt. Apart from diet, other factors like smoking tobacco, excessive alcohol consumption, lack of physical activity, and even stress can contribute to high blood pressure. Managing each of these can go a long way towards lowering your risk. So, how can you manage hypertension with diet? A powerful option is the DASH diet, which stands for Dietary Approaches to Stopping Hypertension. This diet encourages the eating of foods that are rich in potassium, magnesium, and calcium, nutrients that can help naturally lower blood pressure. There are several foods that include these, such as fruits and vegetables, nuts, seeds, and legumes, lean proteins like poultry and fish, and in addition, you can also, just to decrease the sodium, use herbs and spices for low sodium flavor. Potassium helps counterbalance sodium's effect by relaxing blood vessel walls, making it easier for your blood to flow. Foods like bananas, sweet potatoes, and leafy greens are all excellent sources. The DASH diet is highly recommended because it focuses on whole foods that support overall health, not just blood pressure. Try incorporating some of these foods in your meals and see if it helps. All right. Next up, let's talk about cholesterol. Cholesterol is a molecule in your blood that the body actually needs to function properly. But when levels get too high, especially the bad form of cholesterol, such as called LDL, it can lead to plaque buildup in your arteries, increasing your risk of coronary artery disease, heart attacks, and strokes. Hyperlipidemia refers to this high cholesterol condition where there is an excess of this molecule in the blood. It's influenced by both genetic factors and lifestyle choices like diet and exercise. Many people don't realize that they have high cholesterol because it doesn't have an obvious symptom, but it's easy to find out with a simple blood test. To help manage cholesterol, diet is key. Foods high in saturated and trans fats like red meat and processed snacks can raise LDL cholesterol levels. Instead, focus on fiber-rich food, which helps lower cholesterol naturally. Some examples of cholesterol-lowering foods include oats, leafy greens, nuts like almonds and walnuts, and olive oil. Small dietary changes like these can make a big difference in managing cholesterol over time. Finally, let's talk about prostate cancer, one of the most common cancers in men. The prostate is a small gland that's part of the male reproductive system, and as men age, the risk of prostate cancer increases. Family history is also a factor, so if a close family member has had prostate cancer, it's worth talking to your doctor about getting screened. Although you can't control risk factors like age or genetics, lifestyle choices can play a role. Avoiding smoking, eating a diet high in fruits and vegetables and whole grains, staying active, and maintaining a healthy weight can all help lower your risk of prostate cancer. One of the best ways to catch prostate cancer early is through regular screenings. Talk to your doctor about what's right for you, especially if you're over 50 or if you have a family history of the disease. Remember, a proactive approach to your health today can make a big difference in the future. I hope today's video has shown you and given you some useful insights into managing blood pressure, cholesterol, and prostate cancer risks. Remember, small changes made consistently over time can have a big impact on your health. Don't forget to like, subscribe, and share this video with someone who could benefit. Thank you for watching, and listen, take care of your health.